Hello everyone and welcome back to our channel. My name is Sogol Dargahifar and I am an Associate Manager and Family Therapist at Embracing You Therapy. Today we are discussing a very important topic, the link between living with ADHD and its potential connection to addiction. This can be a challenging experience for many people, but by understanding the relationship between these two, we can explore practical strategies to help you or a loved one take steps toward a healthier and more fulfilling life. So let's take a closer look. To begin, ADHD or attention deficit hyperactivity disorder can significantly impact daily life. It affects a person's ability to concentrate, organize tasks, and control impulses. ADHD can also negatively affect academic or work performance and may interfere with social development. Many individuals with ADHD actually turn to substance abuse as a way to cope with these challenges. Studies shows that around 21% of men and 13% of women with ADHD misuse drugs or alcohol. This is often linked to the brain's lower dopamine levels in people with ADHD, leading them to seek substances that boost dopamine. Recognizing this link is vital, not just for treating addiction, but for addressing the underlying symptoms of ADHD that may contribute to substance use. So let's talk about what you can do to effectively manage ADHD and avoid the cycle of addiction. The first and most important step is to seek professional help. A comprehensive treatment plan, one that includes therapy, medication, and lifestyle adjustments can make a profound difference. Therapies like cognitive behavioral therapy or CBT are highly recommended. CBT helps individuals with ADHD manage impulsive behaviors, improve emotional regulation, and develop better organizational skills. It also addresses the negative thought patterns many people with ADHD experience, allowing individuals to reframe their thinking in a more constructive way. With the guidance of a professional, you can also learn to set SMART goal system. SMART stands for specific, measurable, achievable, realistic, and timely goals. This approach can transform overwhelming tasks into smaller, manageable steps, helping those with ADHD stay on track. Step 2 is developing healthy coping mechanisms. This is essential, especially when dealing with both ADHD and addiction. Mindfulness, for instance, is a powerful tool. It encourages individuals to stay present and fully engage in the moment, reducing impulsive reactions and allowing for more thoughtful decision making. Some people find it helpful to use grounding techniques like focusing on their senses. This can calm the mind and help manage stressful or overwhelming situations. One of the grounding techniques that I personally use with all my clients, especially those dealing with ADHD and addiction, is the 5-4-3-2-1 technique. This technique is a simple but effective way to bring attention back to the present moment, which can be especially helpful when someone is feeling overwhelmed, anxious, or unfocused. So here's how it works. Let's practice. Acknowledge 5 things you can see. Look around and consciously name 5 things out loud in your surroundings. Acknowledge 4 things you can touch. Focus on your sensation or objects you can physically feel. This could be the texture of your clothes, the floor beneath your feet, or anything within your reach. Acknowledge 3 things you can hear. Listen carefully and identify 3 distinct sounds around you. This might include distant traffic, the hum of a computer, or the sound of your own breathing. Acknowledge 2 things you can smell. Take a deep breath and notice 2 different scents in your environment. If nothing stands out, think of 2 smells you'd like. And lastly, acknowledge one thing you can taste. Finally, pay attention to any taste in your mouth, whether it's from a food, a drink, or just absence of a flavor. These relaxation techniques are important for maintaining emotional balance. Whether it's taking a walk, listening to a podcast, spending time with loved ones, or practicing any of these activities, find what relaxes you is key to handling the daily stressors that come with ADHD. Lastly, creating a structured environment is crucial for individuals with ADHD. This includes building routines and organizing your surroundings in a way that makes your life easier. One strategy that we call habit stacking involves linking new habits to existing ones. For example, if you have a routine of making coffee in the morning, place your planner by your coffee machine so you remember to plan your day while you wait for your coffee to get ready. Having a clear routine can be extremely helpful, even if your days are unpredictable. Start with consistent activities like your wake up time or bedtime. You can also set up physical spaces like designated spot for your key and bag so that you are not scrambling in the morning. In conclusion, while living with ADHD and managing addiction can present significant challenges, there are practical steps you can take to improve your quality of life. Seeking professional help, adapting healthy coping mechanisms, and establishing a structure are all critical components in breaking the cycle and building resilience. Remember, progress doesn't have to be linear, and small steps can lead to meaningful change over time. Thank you for watching today's video, and if you found it informative, please consider subscribing and sharing it with others who may benefit. I believe together we can foster a supportive community where we help each other navigate these challenges and move toward a brighter future. Take care, and we'll see you in the next video.